Thank you so much for joining me today. I just wanted to talk to you briefly about a great assessment that I use quite frequently called the VBMAPP. This is the Verbal Behavior Milestones Assessment and Placement Program. And it's created by Dr. Mark Schunberg, and it's a really valuable assessment. It's originally outlined for children birth to 48 months, but I've come to find that I have clients of all ages that I've been able to use this with, so I encourage you to not disregard it just based on the age level. So what is the VBMAPP? The VBMAPP is a criterion referenced assessment tool, and it's also a curriculum guide and a skills tracking system. So it's really, really helpful because it's designed specifically for children with developmental concerns and language background concerns, as well as behavioral difficulties. And the goal is to be able to help you identify what behaviors might be getting in the way and what language skills you want to teach next. A great thing that I also find that I love about the VBMAPP is that it includes all forms of communication. And I know that many of our individuals with charge use sign and picture requests and vocal communication and a variety of combination of things. And that's what's really great about the VBMAPP is it recognizes all forms of communication, but it comes from a very behavioral based background. It's based off of B.F. Skinner's verbal behavior of language. So it really is, what skills do you need to move forward and build from, and build in very small steps, and what exactly it is that you need to provide is provided right here in the VBMAPP, so you don't have any guesswork as to what to teach next. So let me tell you just a bit about the VBMAPP. It comes with 5 components inside. It has a milestones assessment component that comes with 170 measurable skills. And for those of you who are professionals reading this, I did say measurable. So what this means is it can map on directly to your IEP goals, and it's very helpful for building language, social play, social skill interaction goals directly from measuring where the child's currently at and what you hope to build towards. All of those skills are sequenced. So like I had mentioned, you have to have prerequisite skills before you move forward, and the VBMAPP shows you those things. There's also a barriers assessment that takes a look at about 25 different common problem behaviors that are likely to get in the way of you teaching language, teaching those social behaviors, and get in the way in the classroom. That way you can specifically look at those behaviors as a team and determine where you want to move to next. The other part of the assessment is a transitions assessment, and this is really helpful because it allows your IEP team, your individualized education plan team, to make database decisions as they move forward. We find it to be very, very useful. The next part of the analysis of this 5-part of the system is a task analysis and a skills tracking system. So what this is, it allows for a greater breakdown of what skills you are teaching and what 3 or 4 skills need to come before that. And I'll show you an example of that in just a moment. And then lastly, it comes with a placement in an IEP goals section. So this allows you to take a look at all 4 of the other categories of the VBMAPP and continue to build from there. And I find this to be really helpful for IEP teams, and it really makes sure meetings go so much faster and parents are really happy with the goals because it directly maps onto what skills need to be taught next, and parents can watch the progress over time. So let me show you a bit about what that looks like. I'll show you one of the very first intro questions that we are looking for. So here on the VBMAPP, we have highlighted what the next question is that we're asking. So we're looking here at how the child requests items or requests things that they're interested in. Their favorite toys, favorite foods, requests you as a parent. What are they looking for? And the first one says that they should omit 2 words, whether that's a picture exchange, a sign, whatever it might be, and that they could have a prompt. It could be present, or they might not have a prompt present. So here we have that first question. When we go to the next part of the assessment, that's this task analysis, it gives us, for that very first question, 4 other skills that should occur first. So if you're having trouble with your child meeting this goal, it gives you all the other goals that you want to work on before you get there. I have never seen an assessment more detailed and broken down into subsequent task than this assessment. It's so helpful. So as you can see, these continue to build. So when you get to your next goal, it gives 5 or 6 other things that you should be building on to get to that goal. And that's really helpful for some of our children who have a more developmental delay and maybe more language barriers present, to really know where we want to start next. And then you can maybe say, well, you know what, they do the first two, so I need to start at the third one. And that can be very, very helpful. What I also like about this assessment is that it includes things like social skills, independent play skills, the ability for your child to interact with another student and use their language, as well as it continues to build into academics and classroom behavior and social behavior in the classroom. So it really takes language and generalizes it to all aspects of the life, which I think is so important for many of our children. Lastly, it also generalizes for your team. I know as parents, we frequently get frustrated with our IEP teams and what's moving forward. And this really allows us to show the team, hey, there's 170 measurable goals here. How can we find out where my child is and what goals we should be working on to move forward? So I encourage you to ask your team if they have anybody qualified to use the VBMAP. Once again, it's that Verbal Behavior Milestones Assessment and Placement Program. And anybody who has experience with either behavioral analysis or language, your speech language pathologist should be able to use this, or who has experience with assessment. And if they have experience in those areas, this should be a pretty easy protocol for them to learn. It can be purchased online, and the school district should be able to do that. And they also have an iPad version as well. I think it's a great assessment, and I really, really enjoy it for many of our children. And I think it can build skills so much faster than us haphazardly picking goals and not measuring them over the time. Speaking of measuring them over time, it does come with a very detailed tracking system. Let me show you an example of that. So you can see over time how your child's been doing. So here's a skills tracking form. Here's an example of a child, and highlighted in the yellow, you can see all the skills that they've gained so far, some areas where they're maybe having difficulty. And then for my next assessment, I would highlight that in just a different color and continue to track them over time. So you can see where skills maybe were at the start of the school year, at that first marking period, and then as you move forward from there. Or you continue to contract that in your preschool program as well. So do be sure to take a look at this assessment and ask your districts about it and see if they'd be interested in using it with you. Once again, the Verbal Behavioral Milestones Assessment and Placement Program. Thank you so much for your time today.